Hi, I'm Erik Gustafson, the Executive Director of the Education for Peace in Iraq Center, EPIC. And I'm really excited to give an update on our campaign. Thanks to so many of you who have been contributing, which has been so awesome. We've already been generating funds and we've been putting those donations directly to work on the ground. So working with our amazing partner, the Iraq Health Access Organization, also known as IHOW, led by Hala Al-Sarraf and her amazing team. We were able to partner with Iraq's leading psychologist, Dr. Abdul Manaf Al-Jadari. He's based in Jordan, but he came to Iraq to be able to conduct an assessment of mental health care needs and psychosocial needs of these areas, these populations that have been impacted by the war in ISIS. And it's been amazing. That assessment has been done. So he went into the field. He went to the primary healthcare centers. He went to the health ministry in Baghdad, met with the Directorate on Mental Health, and was able to really advocate that the Iraqi government really needs to provide a lot more resources to address these needs across the conflict-affected areas. And really looking at what is needed to be able to address these huge needs that are affecting so many children and families who have been traumatized by their experience of war and with the atrocities that ISIS committed.
Hey, what's going on, everybody? My name is Taif Jany, and real quick I want to say, as an Iraqi, as someone who lived during the last Iraq war and then during the civil war that occurred after that, I can tell you from a personal experience that mental health illness is real. And unfortunately for many of us Iraqis, we don't have anywhere to go to talk about it, especially back home in Iraq. We lack the clinics, we lack the professional care, and that's where you guys come into play with this campaign, because that's exactly what we will target. We will target the most vulnerable kids and families who've been impacted by years of violence, and we will do our best to provide them the care that they need so they can live a happy and more prosperous life.
So Erik, what's next for this campaign?
So we're really excited because Dr. Abdul Manaf has made a number of really important recommendations. And so we now have an opportunity to pilot some of those recommendations at the primary healthcare center level. And we're actually looking at two centers, one in West Mosul, and then the other place we're looking at is in Sinjar. Sinjar is an area that was devastated by the war in ISIS, but also by a genocide. With the international recognition of Nadia Murad, with the Nobel Peace Prize being awarded to her, she's an amazing advocate for the needs of helping the Yazidi community recover. And there's a primary healthcare center in Sinjar that our colleagues with IHOW are working at. And so we also have an opportunity to be able to pilot those recommendations right there in Sinjar.
It feels so, like, personally, this is so rewarding to join this effort, but also right now to sit right next to Erik, who is a US veteran, and I'm an Iraqi citizen, and for us to come together to tackle this is like exactly what I feel like we as Iraqis need to see. We need to see Americans and Iraqis come together to help those in need, and this is exactly what you guys will be doing by contributing to help us reach our goal for this campaign. So please do contribute and donate, because every dollar can make a huge difference in the lives of those in need.
I do hope that those who are watching, especially federal workers, U.S. service members, folks that know about CFC, we now have a CFC number. We're
Awesome.
a CFC charity, so we're officially listed. We'll make sure we have that number, because I don't have it memorized yet. But we'll make sure that we have that number front and center so that you can designate EPIC as your charity. But right now we need you to contribute to the CrowdRise campaign so that we can reach that goal.
So make sure you contribute, help us reach our goal, and also help us spread the word by sharing this video with your friends and family members, and because we can really come together and make a big difference in the lives of those in need. Thank you.
Thank you so much.